Hello again. This is Dr. Barry McCool from Texas Tech University and the research group that is being funded by CPRIT. This is part 2 of a part 4 series on cancers and reducing your risk of cancer. This one will concentrate on melanoma cancer, skin cancers from sun tanning, and the use of tanning beds. Skin cancer. What is it? Well, you expose your skin to the UVB and UV ray, ultraviolet rays from the sun. Your skin gets burned, it turns bright red, you may blister, and that blistering is what breaks down the tissue of your skin and makes you susceptible to skin cancers. And there's 3 specific types that I will talk about a little later in this presentation. 1 out of 5 Americans will at some point in their life have skin cancer. If you've had a really bad sunburn as a child and blistered, your chances of getting at least 1 skin cancer is about 55%. For what to look for, as you're doing self-examinations, you want to look at areas that are really exposed to the sun on a daily basis. The tips of your ears, maybe the tips of your nose, your lower lips. These are areas that are highly susceptible to sun's radiation, and if you wear a baseball hat or some kind of cap of that type, you're really not protecting your ears or the back of your neck, whereas a floppy brim hat like a cowboy hat really protects a tremendous amount of the exposed skin. I've asked at previous demonstrations, how many people have seen cowboy movies where the cowboys aren't wearing their hats or they're wearing short sleeve shirts? And seldom, if ever, do you see in westerns from our previous history people wearing short sleeve shirts. And the only time a cowboy has his hat off is when he's in a fight and it gets knocked off. So wear your floppy brim hats. The 3 types of cancers that are associated with sunburn and tanning are number 1, which is the basal cell carcinoma. Approximately 1 million Americans every year get it. It's the most common form of cancer that anyone in any country can get, and that's the basal cell. The squamous cells are most frequently found in areas exposed to the skin, like I was talking about, ears, nose, lips. The killer is melanoma cancer. These are cells that are highly invasive. They spread throughout your body. They use the lymph nodes, lymph glands, and they can really be tough to eliminate. So you really want to be using sunscreen. This is Brittany Litz. She was Miss Maryland. She was the head cheerleader for the Washington Redskin cheerleaders for the Washington Redskin football team in the NFL. She used tanning beds to maintain that golden glow tan for all the beauty pageants that she was in. Since that time, she's become the spokesperson for the Skin Cancer Foundation of America. She's had 25 surgeries to remove cancers from all over her bodies, and she attributes this to the fact that she used tanning beds 3 to 5 times a month to maintain that glow for the pageants. Today, she says, please do not use tanning beds. If you go to the beach, use sunscreen and use coverings like broad brim hats to protect sensitive areas. Indoor tanning. Is this a safe means of tanning that gives your body that nice golden glow and I'm not out there exposed to UV rays? And the answer to that question is wrong. Tanning beds, if you think about it, intensifies the amount of UV radiation that you're exposed to, in equivalent to 15 minutes of tanning is a whole day at the beach. So you can just extrapolate from that there's a real problem associated with tanning beds. Research has shown that indoor tanning, if you do it like 3 to 4 times a year, you increase your chances of skin cancer by 15%. It'll kill you. More than 8,000 people a year in the United States die from melanoma cancers that are attributed, research is showing that is attributed to the use of tanning beds. There are alternatives to that if you must have that glow. As much as I hate to recommend it, is use the tanning out of a bottle or spray that you can put on that gives you that temporary nice tan glow. Don't go out and get exposed to these UV rays that are going to kill you. Is tanning ever a good thing? And the answer is no. People seem to think that I need to have that vitamin D that I get from being exposed to the sun rays. And on our diets today, there's more than enough vitamin B to maintain your body's requirement. You don't need to be out there in the sun. I realize that out here in West Texas, it's almost a guarantee that you're going to be out exposed to the sun rays. And if that is so, take precautions. And some of those precautions are seek the shade when you can. If you don't have to work from 10 to 2, the most intense time out in the sun, don't do it. Avoid using tanning beds and being exposed. Examine your skin from head to toe every month, looking for changes. And one of the things that dermatologist talks about is if you have a mole on your body, check that mole periodically, because that's going to be the first indication that you have a problem, because these moles tend to change color, size, and shape. And when that does, that's a key indicator that you better go see a doctor. Cover up, use sunglasses. If you're using a sunscreen, apply about 2 tablespoons of sunscreen to your entire body about every 30 minutes before going outside. So you put it on before you go out. If you go into the water, if you are sweating profusely because you're really working hard in the field, reapply it about every 30 minutes. Babies, newborns should never be exposed to the sun. Their skin is so sensitive to sunburn that even a short period of time can affect them for the rest of their lives. What's sunscreen? Well, SFP, sun factor protection. It is used to protect you from the UV rays. And there's 2 types of UV rays, UVB and UVA. UVA causes the most damage to your skin. It's the most dangerous type. So you should use a broad spectrum sunscreen. And I have several examples of that I will show you in just a moment. UVB is the culprit behind sunburns, while UVA is the culprit behind the deep damage that starts the process of melanoma or basal cancer. Most sunscreens of SPF 15 or higher are going to provide you with the maximum protection that you really need out there. FPF 30 is really good if you're going to be out for long periods of time with exposure. The research hasn't shown that if you spend the money to buy sun protection factors 50, 80, 100, that they do really any more for you than a factor of 30. So you want to really take a real good look at what you're buying, because you may be spending money that you don't have to. Men. One of the biggest problems associated with men is that they don't want to use sunscreen. And some of these reasons are it's too greasy and oily, or it takes too much time to apply. Also, dirt and sand and stuff sticks to it. And finally, I don't want to smell like a coconut. Well, I have here some of the products that are available on the market today. This is Coppertone Sports. And when you're buying sunscreen, you need to really look at the labeling, because if it says waterproof and sweatproof, it's not. It's not waterproof and sweatproof. It's water resistant and sweat resistant. So you want to look at the labeling. If and the label says waterproof, that product probably is being pulled off the market. This particular case, this Coppertone, I'm going to show you a short demonstration, especially for the men that might see this, with the understanding that as I spray this on, you'll see that it is not going to be greasy, it's not going to be oily, it's not going to, well, you can't smell it, but it's not going to smell like coconut oil. When I spray that on, As you can see, when I sprayed that on, it dried almost instantaneously. If you look at my hand, it isn't oily, it's not greasy, it doesn't have a bad smell to it. It doesn't smell like the coconut oil that you get for products like some of these Hawaiian dark tanning lotions and oils that really have a lot of coconut oil in them. So you can't use that as an excuse anymore that men use, that I don't want to smell like a coconut. Prevention, sunscreen, use a broad spectrum, like I said. If you go into the water and you're sweating, reapply it after 30 minutes. If you go to the beach and you're at the beach for the whole day, you have an 8-ounce container of sunscreen. Out of that 8-ounce container of sunscreen, you should probably use about half of that the whole day that you're at the beach to give you maximum protection for your skin. Like I said, you use about half of an 8-ounce bottle 30 minutes before the sun exposure, put it on. It should be reapplied immediately after heavy sweating or swimming or in the pool. Some of the common myths associated with this is, if it's cloudy outside, I don't have to use sunscreen. If it's in the wintertime, I don't need to use sunscreen. But if you look at these, the sun is reflecting, the UV rays are reflecting off the sun. When you have a cloud cover, you get a much more severe sunburn when it's cloudy. 80% of the sun exposure as a child, so I am beyond help. Well, this day and age, more men have more leisure time to be out in the sun. As you get older and you have this leisure time, you're much more susceptible for skin cancer. So the bottom line here is, if you're going to go out in the sun, use sunscreen. If you're going to the beach, use sunscreen. If you're working in the fields, put the sunscreen on before you go out. We don't want you getting sunburn. We don't want you contracting these cancers. If you have any questions, you can contact me at Texas Tech University. Thank you for your time.